time for another PCOS lab series. I am Angela Grassi, registered dietitian nutritionist with the PCOS Nutrition Center. Today I want to talk to you about measuring glucose and insulin in PCOS. Here are some labs for you to be aware of. First is fasting glucose. Fasting glucose is when you go into a lab after having fasted all night, not eaten anything for at least 12 hours, and you get your blood drawn. And that glucose, that fasting glucose, is going to tell you what your glucose was right at that moment. We like to see levels under 100. For fasting insulin, that's another fasting blood test, and we like to see levels under 10. Usually levels above 10 can indicate some insulin resistance. The thing about fasting insulin, it's not that reliable of a test. It's best done when you get a 2-hour oral glucose tolerance test. If you've been pregnant before and you've had this test done, you know it's a pretty involved test. You have to drink a sugary can of soda or pop, depending where you live, and you have to drink it within 5 minutes, like first thing in the morning. It's usually a really gross flavor orange soda. After 5 minutes, they check your blood at different intervals. They're going to test it in an hour and then 2 hours after you've drinking that sugary beverage. And they should be looking at a fasting glucose with that test, but also it's important to get a fasting insulin. And with those two values, you can calculate what we call HOMA, or a statistical method of determining insulin resistance, the calculation, which I'll put down below. Another thing to know about measuring glucose and insulin is there's a test called a hemoglobin A1C. This is a test that measures how well your blood glucose has been controlled for the past 3 months. So it takes an average of your blood glucose level readings. That alone is not enough to diagnose somebody with insulin resistance. In fact, when you have insulin resistance or have high insulin levels, it's not uncommon at all to have normal hemoglobin A1C levels. Because what's happening sometimes is when your blood sugar goes up, you get a big surge in your insulin, and then it can go down quickly, your blood glucose. So you have like an average of highs and lows, and sometimes it can come back as normal, but you can still be insulin resistant. Let me know if these labs make sense to you, if you have any other questions, and if your doctor has ordered them for you.